Hi, everyone. My name is Caroline Grantham, and I am a family nurse practitioner and a Doctor of Nursing practice student at Delta State University. My DNP project focuses on increasing breastfeeding self-efficacy, which means strengthening your confidence in your ability to meet your breastfeeding goals. As part of this project, you completed a brief questionnaire about your breastfeeding confidence, and you will complete it again after this video to see if your confidence has changed. Breastfeeding isn't just about milk supply, it's about confidence. And confidence is something that grows with knowledge, practice, and support. It is completely normal to wonder, is my baby getting enough milk? Am I doing this right? Why does this feel so hard? Those questions do not mean you are failing, they mean you are learning. Today, we're going to walk through what's normal, what to look for, and how to feel more confident in your breastfeeding journey. After day 3 or 4 of life, most babies should have at least 6 wet or urine diapers per day and should have poop diapers about 1 to 4 times per day. In the early weeks, a well-fed baby will have frequent stools that are larger than a U.S. quarter, wet, mushy, yellow, and seedy. So look for lots of wet and dirty diapers throughout the day and a few overnight. During feeds, you will hear swallowing and see your baby's jaw moving with each swallow. After feeding, your baby's hands, arms, and legs might appear more relaxed, and your baby should appear calmer than before the feed or sleepy. Your baby may naturally come off the breast when finished. You should also observe your baby behavior after the feed. Do they appear satisfied and calm? Do they rest comfortably afterward? When they are awake, are they alert and responsive? You will begin to recognize your baby's feeding cues, and that awareness builds confidence over time. A comfortable latch is key. Without a proper latch, your baby may not transfer milk effectively, and feeding can become uncomfortable or painful. So, what does a good latch look like? Well, your baby's mouth should be wide open before latching, with lips flanged outward. You want a deep latch with more areola visible above the top lip than below. It should feel like gentle tugging at first, not sharp or pinching pain. Your baby's cheeks should look full, not dimpled, and their lips should form a firm seal without appearing pinched or tight at the corners. You will hear swallowing and breathing during the feed, but you should not hear clicking sounds, which can mean the seal is not complete and air is leaking in. Letting your baby nurse until they naturally stop suckling or release the nipple helps support complete milk transfer. Feeding from both breasts at each feeding session is normal and will promote a healthy milk production. If something feels uncomfortable beyond the first few seconds, it's completely okay to gently break the latch and try again. You can do this by slipping a clean finger into the corner of your baby's mouth to release the seal before repositioning. Different positions like cradle, football hold, or side lying can help you find what feels most comfortable for both you and your baby. These positions will change in comfort level as baby grows and your body heals. In the first few days after birth, mild nipple tenderness can be normal as your body adjusts. Ensuring that your nipples have time to dry after feeding and that your clothing isn't compressing your nipple or breast will help to improve this normal initial discomfort. However, pain that lasts for the whole feeding session and nipples that are cracked, bleeding, or are severely painful are not normal and are a sign that you should contact your healthcare provider. Even if mild discomfort and soreness continue, reaching out to a lactation consultant or healthcare provider can make a big difference. With the right support, most latch issues can be corrected quickly. Newborns breastfeed more than 8 times in a 24-hour period and even more during growth spurts. Feeding frequently during the day and night is normal. If your baby wants to breastfeed frequently, that alone is not a sign that you aren't producing enough milk. Your baby is born with a very small stomach, but as your baby grows over the first few months, their stomach capacity increases and you will notice longer stretches between feedings. Breast milk works on a supply and demand system. The more milk you or your baby removes, the more milk your body is signaled to produce. You may also hear the term cluster feeding, which describes times when your baby wants to feed again and again over a short period. This can feel exhausting, but it is temporary and actually helps increase and regulate your milk supply. These cluster feeding events are usually a sign that your baby is getting ready for a big growth spurt. However, if your baby seems to cluster feed every day or for more than 5 days in a row, you should contact your healthcare provider. If your baby wants to nurse often, you are not doing anything wrong. In many cases, your body and your baby are working exactly as they should. In the first week after your baby is born, your breast will naturally be swollen and engorged as your milk production produces colostrum. Once your milk production transitions to mature milk, you will notice a natural decrease in breast fullness or engorgement. Engorgement can make your breast feel firm, swollen, or tender, and may temporarily make deep latches more difficult. Feeding frequently, applying warmth before feeds, cool compress after feeds, or expressing a small amount of milk can help relieve discomfort and improve baby's latch. Waiting too long between feeding sessions will cause engorgement and could over time reduce your milk production volume. Breastfeeding can feel overwhelming at times, especially in the early weeks when everything is new. If your baby cries at the breast or is frustrated while trying to latch, it does not mean you are failing. Crying is a late hunger signal, and you may need to try a different activity to soothe your baby before trying to latch and feed. Babies have limited methods of communication and will cry for many reasons, including late hunger cues, fatigue, overstimulation, being startled, growing pains, gas pains, or simply needing connection and comfort. Crying is not a reflection of your success or failure. It is simply a communication tool, and feeling activated or even agitated by your baby's cries is not wrong. It is your biological response that drives you into observation and action. Breastfeeding can feel very time consuming at first. In those early weeks, it may seem like you are feeding almost hourly, changing dozens of diapers, and sleeping in short stretches that repeat over and over. This stage can feel overwhelming, but it is temporary. As your baby grows and becomes more efficient at nursing, feedings usually become shorter, more effective, and more predictable. Breastfeeding at week 2 looks very different from breastfeeding at month 2 or even year 2. Think about other challenges you've handled in your life. You learned those skills step by step, and breastfeeding is no different. It takes patience, practice, and support. Each feeding is practice, and each day builds confidence. Occasionally, breastfeeding parents may develop mastitis, which is an inflammation of the breast. Engorgement, swelling, and discomfort without pain may lead to mastitis if untreated. Signs of mastitis can include breast redness, warmth or heat in one area of the whole breast, pain in the breast, fever, or whole body flu-like symptoms. Mastitis can affect one or both breasts. If you notice these symptoms, it's important to contact your healthcare provider. Continuing to remove milk at your regular frequency, either through breastfeeding or pumping, is encouraged. Early recognition and treatment are key, and most cases improve quickly with proper care. Most breastfeeding challenges are manageable with early support. You may feel unsure or self-conscious about breastfeeding in front of family members or others, and that feeling is completely normal, especially with your first baby. Remember, you are using your breasts for their main biological purpose. You have the right and responsibility to feed your baby wherever you are when your baby needs to eat. Feeding your baby is not something you need to apologize for or hide to make other adults feel more comfortable. Comfort grows with experience. The more you do it, the more natural it begins to feel. Some parents choose to use a cover, while others do not. Either option is completely your choice. The most important thing is that your baby is fed and cared for. Your baby's needs come first, and you deserve to feel confident meeting those needs. If you are pumping, especially when returning to work or being away from your baby, know that it is an effective way to maintain your milk supply. Federal laws require most workplaces to provide protections and accommodations for pumping parents, and planning ahead can help you to feel more prepared and confident. Employers are also required to provide a private space other than a bathroom for milk expression. A lactation consultant can help you communicate your pumping needs to your employer and provide education and guidance for businesses on how to better support you. Continuing to breastfeed or express breast milk for each feeding helps maintain your milk supply. Your body responds to stimulation and milk removal, so consistency plays an important role in building and protecting supply. If your goal is to feed your baby exclusively breast milk, frequent and effective milk removal supports that goal. In the early weeks especially, responsive feeding helps your body learn how much milk your baby needs. Sometimes breastfeeding difficulties require families to use a human milk substitute, aka infant formula. Using infant formula is not a sign of failure. It is a sign that the breastfeeding journey has become complicated and support is needed. Infant formula can help with critical feeding problems or be used to bridge the gap between the problem and solution. Providing your baby with breast milk in part or exclusively is valuable. Families should discuss infant formula usage with a breastfeeding supportive healthcare provider prior to making changes to protect both the milk production of the mother and the nutritional needs of the baby. If supplementation becomes necessary, that does not mean you have failed. Sometimes adjustments are needed, and with the right support, many parents are able to continue or return to breastfeeding. Every feeding still counts. Confidence grows through consistency, not perfection. Small, steady efforts over time make a big difference, and each feeding is another step forward in your journey. If you are planning to return to work, establishing a pumping routine can help maintain your milk supply. Many parents begin introducing a pump a few weeks before returning to work to build confidence and create a small milk supply for those first few days apart. Many women successfully continue breastfeeding even after returning to work. You will learn your baby's cues just like you learn their personality. What feels unfamiliar now will begin to feel more natural with time. You will become more comfortable with positioning and responding to your baby's needs. And you will grow more confident over time at both breastfeeding and parenting. Breastfeeding is more than a way to feed your baby. Breastfeeding is about connecting, learning, and bonding with your baby, one feeding at a time. There may be challenging days, but there will also be moments of calm, connection, and success. You are capable, your understanding and confidence builds with every feed. Thank you for taking some time to focus on your breastfeeding journey.